Hi, I'm Amy Braglia-Tarpey, Registered Dietitian and Director of Clinical Growth for Gus Gear. With years of experience managing feeding tubes, I've seen my fair share of tube site complications. Tube dislodgement, hypergranulation, exit site infections, adhesive-related skin injury, you name it. I'm excited to share that Gus Gear's LOCK 3000 is here to help prevent complications from happening in the first place. The Gus Gear LOCK Series 3000 addresses all of these issues in one device. The dual safe strip right here locks down the feeding tube or extension set and the pump set if attached to minimize force to the stoma from any accidental pulling or tugging. A protective cover keeps the feeding tube out of reach. And lastly, an optional single safe strip affixed to the back of the LOCK 3000 when feeding can move the pump set out of the way and reduce risk of medical line entanglement. The literature shows that feeding tube complications are common in children and adults and often result in emergency department visits, hospital readmissions, and urgent clinic visits and phone calls. For example, a 2022 study published in the journal Pediatrics found that 1/3 of patients with a gastrostomy tube, or G-tube, had an ED visit during the 5-year study period. The most common reason for an ED visit in this study was dislodgement of the tube, which occurred in 60% of the visits. Almost 9% of emergency department visits resulted in surgery. Minor complications are also common and detract from quality of life in those who require tube feeding. A 2019 meta-analysis found that 33% of patients suffer from minor complications, including hypergranulation, exit site infection, and leakage. Medical line entanglement, or MLE, is a more recently identified complication. A 2023 survey of 120 parents of children with medical lines, which include those used for enteral nutrition, found that 88% reported that their child had been entangled in a medical line at least once. It's important to note that not only do feeding tube complications put adults and children at risk of adverse medical events, but they also use considerable healthcare resources in terms of time and money. Thane Blinman and Dennis Hill report in their 2023 article, Troubleshooting the Gastrostomy, that approximately 500 feeding tubes are placed annually in their large pediatric institution, and that nurses there receive over 2,000 calls to the clinic each year to troubleshoot feeding tube complications. This is in addition to a daily average of 1.6 emergency department visits for tube troubleshooting, which take almost 5 hours to resolve. Many preventable feeding tube complications result from a lack of protection of the device from pulling and tugging, or a lack of stabilization of the tube itself. Pulling or tugging on the feeding tube, extension set, or feeding delivery system can dislodge the tube. Recurrent movement of the tube in the stoma over time can cause hypergranulation or proud flesh, a red, painful, and irritating protuberance. In some cases, site infections may develop due to bleeding and wetness around the tube. Adhesive stabilization devices such as medical tape are often used to stabilize the tube. However, these can have adverse effects, including adhesive-related skin injury. The Gus Gear LOCK 3000 combines protection and securement to minimize risk of complications and thus reduce troubleshooting interventions and clinician time required. Nurses and physicians save time and resources, and patients and caregivers are thrilled to be safe at home with an intact, painless, functional feeding tube. Next week, I'll talk about securement with Gus Gear for dialysis catheters. Don't miss it. In the meantime, you can check out the references at the end of this video for more information on feeding tube complications. And lastly, be sure to visit gusgear.com to schedule a virtual demonstration and see the LOCK 3000 in action.